I'd really like to thank the three of you for joining us today for the filming of this event for the TDI Biannual Conference. Traditionally, our conference follows a standard format, and as the newly appointed CEO of TDI, thank you, I appreciate that. I like the format of the conference, but I felt it would be nice to have maybe a new feature that I'd call the CEO Fireside Chat, where I would invite you as guests to have a conversation, learn more, ask you questions, learn more about your organizations. I know that we've worked with your organizations in many different ways, but as leaders, sometimes we have a broader view of what is happening today, and that is the goal of this forum. To ask questions based on your experience from your organization, from your personal experience, or your audience, to share with our audience at the TDI conference. So thank you for coming. My name is Eric Kaika. I am the CEO of TDI. I am a white male with a closely shaven beard. I'm wearing glasses. I have thinning hair on top, but in the brightly lit room you probably can't see anything, so essentially I'm bald. I'm wearing a purple shirt with a dark sports coat on. We'll go ahead and start with introductions, and then our chat. To begin with you, Barbara.
Thank you, Eric. I'm pleased to be here. I'm Barbara Kelly. I'm the Executive Director of the Hearing Loss Association of America, and I am a white female. I have brown hair. I'm not wearing glasses, and I'm wearing a bright yellow dress because it's a sunny summer day, even though it's a fireside chat.
This is Howard Rosenblum. I work for the National Association for the Deaf. I am bald with a beard for the first time since COVID. I hope people like it. I am wearing glasses with a blue suit, blue shirt, and a pink tie. Not sure why I chose pink, but I'm glad to be here. Thank you, Eric, for inviting me.
I'm Bobby Cordano, president of Gallaudet University. My pronouns are she, her, hers. I am a female, and I'm wearing a gray suit with a blue blouse. I have blonde hair, and I am wearing glasses. And I'm just honored to be here with all of you with this great group of company.
So, the last 2 years since we had our conference in 2019 to today, wow. The number of incidents happened, our world quickly pivoted and changed impressively with what we've done. You know, our traditional ways of educating children, working, advocating, all of that has had a tremendous change, and we've shifted to a virtual way of communicating. I think that we did good, not perfect, but we adapted well. But I've noticed that there have been several issues with virtual communication. What are some of the barriers that have shown up? I guess we fixed, but they're still there, still lingering issues. And how can we make changes to improve on that? Go ahead, Howard.
You're exactly right, Eric. The world has changed drastically. Many of us have been in advocacy for a long time, and we've seen the same familiar issues and barriers that we all know. Sometimes with new technology, we have to figure out how we make it work for us, but over the last 2 years, that change has happened so quickly on many different levels, both for college education and elementary K-12 education, early intervention, healthcare, work, both in person and remote. Everything you can think of has changed for the world, not just deaf people, but the world, including deaf and hard of hearing people. There are many barriers that are simple, such as masks, to more complex barriers like technology. And accessibility has not traditionally been part of the system. We've been reactive. And unfortunately, that's the case. We react to things as they change, and then we have to remind the outside world to think about us and include our needs, such as captioning, communication, sign language, so many different levels, both technologically speaking and in person. And as changes happen, we have to educate ourselves, figure out what works for us, and then in turn, educate the outside world to help them accommodate our needs. Sometimes they listen, sometimes they don't, but so much has happened in the last 2 years. And much like you, I'm impressed with how we've done. We have a lot more to learn, but our response has been powerful over the last 2 years.
Barbara, I'm curious to know from you how you're getting up. Well, I can really relate to a lot of what Howard said, and I don't know about all of you, but I found that when the pandemic began, we just got busier at the Hearing Loss Association of America. We had people tell us that hearing loss was isolating enough, and then the added layer of COVID on top of that really made it more isolating. And the one thing, we had a lot of people asking us, I need communication access now on the internet. I need it because I'm taking classes, or I'm working remotely, or I need it in healthcare settings. And we were really happy to work with your organizations to come up with resources where we could pull our brain trust of all the organizations together. And that's why I love the collaboration with all of you to put out really solid resources for people. But I think one of the main things that we told people was your rights as a person with hearing loss don't end just because there's a pandemic. And the Americans with Disabilities Act doesn't go away just because there's a pandemic. So we found that people needed more information.
I mean, I want to emphasize the whole point about collaboration. I saw our faculty really being heavily involved with, accessibility and telling employers and healthcare providers what they needed to do in order to be accessible. And to be able to see that collaboration was so powerful, especially when we come together, those who experience a hearing loss, who are deaf or deafblind. Anytime that we come together, regardless of the way that we communicate, and really look towards making sure that everyone has access. I think about the whole virtual experience being very different than face-to-face interactions. When we moved ourselves to the cloud, when we went virtual, it was so interesting to see that there were some gains that came with that, but there were also some losses that were experienced. One of those experiences of loss was that whole sense of isolation. For many deaf and hard of hearing and deafblind people, we rely on being able to lip read, to be able to read people's facial expressions, which even when I go shopping and I go into a grocery store or to the doctor's office, I can get by. We manage in those environments, but now when you bring in the whole concept of people now wearing masks, it completely disconnects us. And it was such an isolating experience, especially for those of us who are deaf, deafblind, have a hearing loss, and then those who use pro-tactile ways of communicating, and then that becoming an issue because people needed to be 6 feet apart from each other. The New York Times said that the CDC's advice and guidelines, when you look at all of their models, they're all stick-figured individuals. And everyone looks the same for how they're depicted. But when we think about us in reality, we're not all the same. We're not like everyone else. So the rules that might apply for the adults that were depicted in the pictures doesn't necessarily mean that that applies to people who are deafblind or even working with children, and how you communicate with them face to face, being at their eye level, sometimes having to kneel down. When they're saying you need to be 6 feet apart from one another, sometimes that's just completely impossible. And we weren't able to provide that advice and guidance as it related to that. So when we think about the whole experience of what happened with our deafblind students on our campus in the beginning of the pandemic, there was no other university who was experiencing that because they didn't have the critical mass like we have. And I look back with a lot of sense of pride from this experience because I realized it gave us an opportunity to be able to work together, to learn about what we needed to do, and to reframe some of their rules about the federal government for who gets considered to have priority for getting PPEs, When we think about interpreting services, that interpreters weren't considered to be first responders, like you have that for the healthcare providers. So they had to wait to be able to get access to those supplies and the equipment that they needed for safety in their work environments. So you had that loss and that disconnect that came from the whole experience of not being able to connect in the ways that we knew how. And when you think about Zoom too, we do a Zoom check to make sure that you're within the frame of the video and that people can see your signing. So you do that by holding your arms up like this, and that making sure that from the elbow to the top of your fist that it's within the video frame. And we've been using these creative techniques for more than 20 years to be able to communicate using VRI, using video technology. I mean, we have our families that are, working with us, and sometimes when you think about the families that they don't know necessarily how to angle the camera so that you're at best in the frame. But that's something that we've already learned how to do as deaf individuals. So we were able to adapt, moving to a virtual environment much quicker than other people. So people who are hard of hearing, deaf, blind, and deaf, that there have been dividends that we have reaped from the fact that we've had these experiences thus far and had to adapt. And I recognize that within signing environments, we saw the benefit within the signing community that was really different. When we think about people wearing masks, you're still able to sign and get by. I mean, it's not the ideal. As signing individuals, people would prefer to be able to read my facial expressions and to have access to that. But if, having to wear masks, you still can communicate with one another and you can get by. And you can make certain adjustments like slowing down your signing pace so that people can understand you better. But, when we talked about early intervention and teaching sign language from 0 through 3, the whole critical point about language mapping and brain mapping and what happens in the brain with bilingual development. When you look at the statistics, 1 out of 8 children who's over the age of 12 experiences a hearing loss, which means that hearing loss is a lifelong human condition. And this experience taught me that we need to really be investing in sign language and making it normal. It needs to be normalized in our country so that there can be communication engagement, that regardless of wearing masks or not, that you're still able to get by using gestures and to be able to sign, that allows people to be engaged and connected, those who are hard of hearing, deaf, or deaf-blind. I mean, there are enough of us, and the difference and the distinction that we have here in our university compared to elsewhere is that I actually would prefer to be here on campus, because having to deal with people wearing masks outside of this campus, it's just not something that I want to have to deal with.
I agree. As you were talking, I was thinking there was a piece of data that I read that the third most treatable medical condition was hearing loss, and that more and more people are losing their number. Number 1 was heart condition, 2 was something else. So when you look at the population growth, it's starting to slow down. And the number of people with hearing loss is increasing. So I'm thinking that at some point, I know that I read HLAA's annual hearing loss report last week, I believe. And I'm pretty sure there's going to be an inflection point where the number of deaf and hard of hearing people are at some point going to exceed the hearing population based on the current trend. And so you're right. It's very important to be aware and mindful of people who sign, and I agree with you that we've already been working with the DHH Coalition, but in the past 2 years I've seen that galvanizing more organizations coming together that may in the past have been overlooked, and I really commend all of us and all of the communities out there as well. Bobby, did you want to add something?
I want to be careful not to only focus on one part of what you just shared here, but I did find it interesting the language that you used when stating that it's the third most treatable condition. It's interesting because what we don't often recognize is that the other 2 conditions, I think it's heart and whatever the second one was, is that they're chronic conditions, which means that they never go away, completely go away. You can mitigate it. You can mitigate the experience. You can provide technology. You can provide language or cochlear implants or even other types of technologies. You can do things to mitigate the experience, but it never completely goes away. So the whole experience of, it's even when you go to bed at night and you take off all of your different aided technologies and assistive technologies, you essentially become deaf. And, that whole experience is still present for that person. And every day that person is living with this chronic condition, one that persists, you learn how to adapt your life to that lived experience, but it does take energy. It takes thoughtful engagement from others to negotiate those spaces in which you cohabitate. It really is a constant negotiation process that occurs. I think that this collaboration in particular that has happened now, especially with the pandemic, with COVID, is that it's been so powerful because of the fact that we have a shared lived experience. We know that the important thing is not about whether you sign. That's not the important distinction. What's important is us coming together due to our shared lived experience of having to constantly negotiate the spoken language environments in which we are in. That's something that's constant for all of us. And I think that's something that we all should continue to remind ourselves about.
I always hear that people with disabilities are natural born engineers. We come into the world ready to find solution to problems we encounter.
Naturally born and some college-trained engineers as well. But speaking of technology, Bobby brought up the power of collaboration, which has been important. Prior to COVID, we had to reach out to industry and innovators and talk to them about universal design, which wasn't always successful. But COVID made universal design far more apparent. For example, video conferencing platforms that we're all using to collaborate nowadays. We've had to compare them. What platforms had and didn't have. Captions, auto captions, the ability to connect to CART, the ability to pin interpreters for meetings, as well as elementary education and college education, especially for mainstream schools. In a deaf classroom, the deaf professors know what to do, like Bobby mentioned, holding your arms up to make sure you're clear and your signing space is there. Whereas in hearing classrooms with a single deaf student who needed captions or interpreters, you have to make sure that captions are enabled before the meeting starts, otherwise they won't work. If they're working with an interpreter and you have 30 tiles on the screen, how do you see the interpreter? We had to learn how to hide non-video participants, other ways to be able to pin interpreters so you could see them at the same time as you could see the class. All of that we had to figure out in a very short amount of time. Educational institutions were trying to figure out what to do. Employers were trying to figure out how to accommodate their employees. Telehealth, for example, with doctors not allowing people to come to their office, so they had to start doing remote clients. How to figure out adding interpreters to those telehealth conferences. It made universal design and the gap become very apparent. And it spotlighted all of that, and hopefully it will lead to change in the future. Like we see now with interpreters. They're almost everywhere. We see them with governors during their press conferences. And a lot of that's because of our community advocacy, some of it because of lawsuits. Love doing the lawsuits. And some just, the community's gotten used to it. Like we saw recently, unfortunately, in Miami, where the condo collapsed. The mayor provided an interpreter during that press briefing. They did. So it's becoming the new normal. We still have more work to do, but hopefully that work continues. And that'll be common, like we see every day at the White House with the press briefings. They have an interpreter, and it's becoming the new normal.
I think there's definitely some positive things that have come out of COVID, and technology certainly provided some pain points for all of us. But we found that older people were willing to kind of be pushed into technology, to using these virtual meeting platforms. And we have chapters across the country who, we always said someday, let's have virtual meetings, but we were kind of pushed into this. And I think it was all a really good thing. And so I would say there have been good things that have come out of the pandemic. But you were also talking about the increasing numbers of people with hearing loss. And in the United States, every day, 10,000 people turn 65. And we know that hearing loss and age go together. In the age group 65, 75, 1 in 3 have a hearing loss. 75 and above, it's 1 in 2. So the numbers are growing, and this group of baby boomers that are now aging into their hearing loss are not like the older people of yesterday. Today, seniors are still working, they're having second careers, they're active and they're fit, and hearing health is becoming a part of overall health. And we're finding that people want to take care of their hearing health. They want to do things so they can stay engaged and stay active and keep communicating. So, yeah, the pandemic brought some technology pain points, but I think that it pushed us in a really good way.
So, on that note, I find it interesting how things come to a point. With the pandemic and now in legislature, they're talking about the 21st Century Communications and Video Accessibility Act. They are talking about refreshing or modifying some of the language. And so now as that discussion is happening, what should we be sharing with them to keep in mind as they rewrite the legislation? How can we make sure we continue to have technical access for deaf and hard hearing people? And I see, Howard, you have a great big smile. Go ahead.
Honestly, I think we need to stop looking at the specifics and having a list of exactly what we need to do. I think we need to look at the bigger picture. Any new technology will be accessible, period. End of story is what we should say. We shouldn't have to say, because of new technology, we have to set up these laws. It should just be across the board. Any new innovations or technology should be required to be accessible.
Right.
That's the
and
easiest
let
way
the
to do
guidance
it.
come from the various organizations and associations such as yours, with the support from research conducted by places such as Gallaudet. Where we can support your organizations in setting the standard with documentation from corporations, nonprofits, and the public sector, where the research can supplement whatever you're trying to make the case for. A good example of this is within the airline industry. And I'm sure that all of us have been on a plane before and we've tried to watch their movies. Are all of them captioned? I don't think they are. And it's fascinating to think about that, because even the TV shows are not all captioned in that setting. So let me ask you, Howard, is it because that the screens are smaller than 13 inches, or what's the reason for the lack of caption shows available?
Okay. Well, there's different laws
if you
that
could give us
apply.
the short version as you answer
And
that
I'll
question,
try my
or
best.
should I say the non-legal summarized version for all of our benefit?
Well, I'll have to come up with another answer then. All right, take it away. It's not a screen size issue. The fact is, planes follow different laws. The ADA does not apply once you're off the ground and in the air. The ADA only applies to the land United States. So they follow the airlines follow the Air Carrier Accessibility Act, the ACAA. And that law doesn't mention anything about captioning or making TV programs accessible. It's a very old law, I believe.
Yeah, it's an antiquated law.
Passed in the 1960s, I want to say, 1960s.
Yeah, that law precedes the
Right.
advent of streaming
Before
technology.
all of that.
That was established into law well
Right.
before that type of
The
technology
only
came about.
part of that law that requires accessibility for visual or captioned information is the safety video at the beginning. Sometimes they'll do it live, where they'll point to the exits and direct you to where things are on the plane. And so that they don't have to make accessible, but any videos for the safety videos have to be captioned. So airlines have also started adding ASL interpretation, which kudos to those airlines that are doing that. But it doesn't mention anything about other information. And that's why a few years ago, when we were working with a disability group, we were trying to address several different issues related to accessibility on the airplane. For example, wheelchair accessibility for the toilets, emotional support animals. And also we tried to address IFE, in-flight entertainment. And we tried to file a junction with the FCC arguing that TV shows are covered under the CVAA and the FCC declined to pursue that, unfortunately. So that's the short answer.
You know, the act as well, I believe, prevents people from suing the airlines. I remember at one point they refused to allow a deafblind person on the aircraft because of COVID, and they blatantly discriminated against the deafblind person, and there was nothing he could do.
Right. That's one drawback to that old law, the ACAA, the Air Carrier Accessibility Act. It stipulates no private right of action, which means you cannot sue the air carrier. You can file a complaint with the Department of Transportation, but all they're going to do is give them a slap on the wrist and tell them to do better.
I didn't mean to divert our attention to the topic of air travel, especially because people have stopped traveling due to COVID. So let's get back to talking about what Barbara had mentioned about hearing loss and experiencing isolation during the pandemic and what's now changed due to COVID. I mean, there's been some positive experiences, but also some challenges too that we've been presented with. The positive side of COVID is that it's taught us how to be a virtual community. We're able to find each other virtually in the cloud, where we're using communication technologies and strategies very differently now. Even with my family, we have a mix of deaf and hearing people. And I remember back on Thanksgiving last year where we all got together and I was in a house with some of my hearing relatives, and they were sitting around the table and they were okay with having laptops and computers in front of them, and I had my iPad in front of me on a stand. My son had the same thing where he had his on a tripod. And then their family relatives that were deaf and hearing that were elsewhere all joined us through Zoom for our Thanksgiving dinner. And the great thing about it is that anytime that somebody spoke, that it was captioned right there in front of me. No one had to interpret. I could enjoy the conversation for having all the members of my family together, and that was a first-time experience for me. It was a virtual dinner that we had together. Now, don't get me wrong, it doesn't replace the face-to-face experience, but it gave me that level of access to others in my family, which was very powerful. And I think that that's been true for many people to have that experience. It's taught us different strategies that then go about influencing how we think about getting together in person and what we can now do differently. People will have their phones in front of them so that the person who's next to them can have captions. I mean, what can we continue to innovate here from what we've just done? I think another term that we can think about here referring to our community is that we're all hackers. When we see something, we'll make sure that we change it to be able to accommodate and fit with what we need it to be. So I think hackers is a term that's being used in the younger generation now, and I think that they like to refer to themselves as hackers more so than engineers. Maybe that's an out of style, out of date term there, Howard. But when we're talking about engineers, I think there were more hackers in that way, and they like that term. But, I think that COVID, the pandemic, has really amplified that deaf experience and the experience that people have with a hearing loss about really losing that sense of community. You talked about people with a hearing loss who already have felt isolated with this. Now, when you think about wearing masks, it's really difficult to talk on the phone. I mean, that has just made video communication really the most important thing, and it's what saved us, I think. But that face-to-face conversation allows you to have interactions with one another where you can ask people to repeat themselves, and it's really developing that relationship in a very comfortable way. And I don't think that Zoom allows us to be able to do that. So when we think about the younger generation and with children and even students, one great example is that there's a college student who was at a hearing college before the pandemic, and then COVID hit. And that student was then almost failing their classes because they couldn't get the technology, things weren't accessible. And so she really struggled. So she decided to come to Gallaudet. So she transferred, and she's been able to flourish because of the fact that we have Zoom technology. And even though we're virtual, she can communicate with people through the use of sign language and see one another. So we have the experience already under our belt of using technology, even thinking about how we open our conversations and checking to make sure that people can see one another before we even start. I mean, if you think about this student, how many more are there like her who weren't able to find the programs that we're able to adapt? And my worry is that there are more children and adult learners that have been left behind, especially during COVID. So we have to worry about that. And we have to be sure that our students and our learners and children, if they're experiencing this, then this is probably true for almost everyone. Again, it doesn't replace the, direct learning that you get when you're in the classroom with your peers, if you're doing it through virtual technology. But I think that we've also learned that some of our younger students at the Clare Center, through this experience, we've learned that they actually have been better at advocating for themselves with their teachers to tell their teachers what they need. When they're at home, they don't have people who are there doing it for them throughout the day. So our support staff and our teachers and professionals at the Clare Center realized that we were doing too much for them before. And they're able to allow there to be more autonomy and independence because they know that the students can handle it. So I think it's a mixed bag, of gems that have come from this, but also realizing where we have some work to do to get ourselves caught up. And I think that the last thing for me that I, remember is having the experience from when COVID first started. We had a couple of faculty who were talking about COVID, and they did this in sign language. And so we opened it up for everybody to watch, to talk about what is the implications of COVID. And 40,000 people from around the world viewed this and watched this. It's 40,000 people. So it had 40,000 views, which I think, goes to show that there are people who are out there who need information from us. It needs to be delivered in a way that they can receive it, that they can understand it, that it's digestible, and they can understand the impact that it's had on their life. And I think, there's more to come in that way, where it's going to be our responsibility to continue to share this information and to share the resources with people and the expertise that we have. I mean, Barbara, you talked about those numbers, and it's staggering how many people are, getting access to that information from what your organization has compiled. And, there are different ways in which we can go about improving that.
And you even think about people with mild to moderate hearing loss who during the pandemic all of a sudden became aware that they might have a hearing loss because they were wearing masks, they were having to stand 6 feet apart, and they started to realize that they were hearing less. They needed some type of help. And we heard anecdotal evidence that people were then inspired to go get some hearing help, which is good. So, I tend to look at the bright side of things. You probably have noticed, but
It fits your outfit. Very bright.
Thank you.
So, can I ask you, Barbara, here, because I wanted to hear more about that. And maybe I'm just simply behind being so preoccupied with COVID and getting everyone back to our university for this fall and even the summer, and then eventually the fall. But can you tell me about that experience of hearing less? I don't know, this is the first time that I'm hearing about that, so maybe I'm just behind.
Some various webinars and people talking about masks. And masks can reduce the decibel level. We've heard anything from like 5 decibels, even up to 25 decibels. So then you add, 6 feet of physical distancing, and people are really starting to experience hearing loss, and maybe realizing, becoming more aware that they're not, maybe they're hearing speech, but they're not understanding speech. So the masks have added not only the visual cues that people need, because we all lip read. I think everybody lip reads a little bit. And lip reading is a tool in the toolbox, right? So you take that away, and then people start to realize that they were doing more lip reading than they might have realized.
I think it's similar for the signing community. We've had that same moment of realization. You mentioned people who didn't recognize their hearing loss. But deaf people are used to that. In schools, we get so much access given to us, and then when COVID happened, we didn't know what to do. I think a lot of people realized that their rights had been taken away, and we're trying to figure out what to do at this point. And that resulted, as in Bobby said, 40,000 people watching their webinar. In terms of NAD, prior to COVID, we probably had about 1,500 contacts a year. And since COVID happened in the past year, we've had 4,000 people reach out to us, more than double, almost triple. And so we've realized, with all of us having worked to the bone since March, April, and May, trying to put those resources together, new position statements, new concepts of what people's rights are, how to use technology. We've rushed to put all these resources together for people to use and empower the community to support themselves. We've seen sign language interpreters readily available at governors' press conferences And that's been a huge change. And I think a lot of people have taken the steps to take back the power that they felt they lost, the rights that they lost. And they're advocating for themselves again. And that's the new world that we're living in. Deaf and hard of hearing people usually are left behind in terms of getting information. Once it's disseminated, we are usually the last to get it. And we have to fight to get that information. We, as organizations, have made that available, and we saw how hungry the community was for these resources. And so that's been a big change. Before I move on, I do want to recognize two specific groups that are out there that are still being left behind, even during COVID, who aren't getting services. Deaf-blind individuals, for example, who are already further behind than the deaf community, now are struggling. They need that tactile touch. Technology is not accessible to them. And they can't always get that because we're doing social distancing, we have masks, and various other reasons. And also the second group are people working on the front lines, in hospitals, apartments, banks, grocery stores, Amazon workers, many of whom are deaf or hard of hearing, are having to go to storehouses and work. And they're missing out. And they have to deal with people that are wearing masks at work. They're earning less on an average basis, making ends meet as best they can, trying to figure out how to survive during COVID. Especially people who have lost their jobs that are struggling financially. There's a lot of recovery that we will have to do. We can't just say that COVID's at its end and we're doing well. There's still people out there suffering.
Yeah, and I think I would add to what you shared there, Howard, about what's required of us, especially over the last year, since last summer and the murder of George Floyd. It's that going forward, we must focus on our recovery and what's needed. We're still going through it. Don't be mistaken that I know that we're all vaccinated here, which is a good thing, and we've all agreed to take our masks off for this panel conversation. Yet at the same time, we know that the variants are out there, and we don't know enough yet about whether or not our vaccines are going to be able to protect against those variants. So we're not completely out of the woods yet. But, as we continue this fight to restore ourselves and to get back to community living, once again, for what we lost was really the aspect of community in the workplace, within the community, even our home environments where we convene with our family members, as we work to bring back that sense of community, which I think is really at the heart of human existence, that humans really live and thrive when they're a part of community. That's really fundamentally part of who we are and our nature. So as we look to be able to rebuild our community, we have to make sure that we think about intersectionality identities and equity and use that lens as a part of this work. We need to be sure that we're looking at every single decision using an anti-racist lens. Asking ourselves, for the work that had happened before, did every single person receiving this service or who was in a part of this class or organization receive equitable opportunities, have equitable experiences, and have equitable support? And when we think about racism and the impact that it's had in this country, and then understanding the impact that it's had on people of color across this nation, they've not had the same access to opportunities and knowledge, technology, resources, and support. And at one point, I remember learning that 68% of young Black men who are incarcerated have a learning disability. And I often wonder, knowing that it's such a high statistic, how many of them actually have a hearing loss that has been undiagnosed. So just them not understanding what the rules were within the class, and it was simply because they did not understand or hear the instructions. Maybe the teacher asked them to do something and they just simply didn't hear it. One of the last thing that people will diagnose is a hearing loss. They'll diagnose other conditions and behavioral issues before they'll say, maybe this person also has a hearing loss. So it's pervasive. And I think that the opportunity that we have before us is that when we look at the inequities related to access, knowledge, and resource for what people of color have, from what our organizations have provided. I think our challenge is going to be taking a look and reframing this as when we're restoring, rebuilding our communities, that we're not just looking to do the same thing that we've done before, but we're making that shift. And now is the time to do it because the awareness is much higher. I think the motivation that people have is there, and the imperative is there as well. And our communities have spoken in this country with Black Lives Matter. I think that it's time for us to be responsive and to learn together how to do this work going forward. I think that's going to be important.
I agree with what you're saying, and to paraphrase with what you just said, accessibility is a civil right, it's a human right. People in this country should be able to have access to the technology information they need. And people who are deaf and hard of hearing have long been fighting for this access, but people of color and those from other marginalized communities have their own battles as well. Technology requires financial support. It requires, access at home. It requires a lot of things that are in play to make sure that everyone has an equitable experience, that our service, our products are inclusive and equitable for every individual. And I think our organizations have recognized that, we've collaborated well, we've been changing and working with these communities to elevate them. Because as we modify these laws and make these policy proposals, they do benefit the deaf and hard of hearing person, but we have to keep in mind for those of others. For example, the most restrictive person, if we were to design our accessibility for them, then
It's like we
theoretically it
said.
should benefit everyone.
There needs to be universal access to the internet. Right now, many students are doing their education from home virtually. And do they have access to the internet or a computer or a device that they can use? Maybe they have one, but they're living in a household of 3, 4, 5 people. Many schools, including Schools for the Deaf, were able to hand out technology and equipment, including MiFi, to their students. But we recognize, or at least many of us do, that technology and phone companies need to lower their costs of service, especially to people who are underserved. And those low-cost services, are they enough for deaf or hard of hearing people? They may have a data plan on their phone that they're maxing out because they're using video services to use sign language. So they're capping out on their data plans. We have a similar problem with deaf individuals that want to do school through video, making sure that they have access. And you're exactly right. Those who are the most limited and impoverished should have access to basic needs. And we're talking about basic things you need to live: a roof over your head, water, food. That should include healthcare and internet.
Right, and I think that we might need to broaden our conversation a little bit here too. We've talked a lot about civil rights, we've talked about laws and making sure that we have access. But I think that you're right, Howard, when you were talking about universal design and making sure that it's really about inclusive design. And inclusive design is not necessarily, when you look to see how that's different, it doesn't necessarily mean that we have to conform to be able to fit with what the norm is. It's really that the norm needs to be changed in order to be able to accommodate and fit with many different types of people. So that's a paradigm shift that needs to happen. And a lot of our laws and decisions that have been made thus far have really focused on how we as people have to fit with what the norm is and what we can be given in order for us to be able to operate in the same way. But I think it's more about shifting the norm so that we can actually thrive in any type of situation. And that's a paradigm shift that has not completely happened, and I think that's going to be our work going forward. The second piece is about economic justice. We now have come to understand, and doing some preliminary research and looking at the data and doing some analysis here, that we've estimated that the sign language economy in the United States is worth about $2 to $3 billion. And, it's really about economic justice in terms of opportunities that are afforded to deaf people in this country. And if you look at those economic opportunities and economic justice as it relates to healthcare, access to hearing aids and aided technology, and you look at the cost of aided technology, When children are diagnosed within a school system, I mean, it's great because insurance then can cover what they need and we can give them those devices. But for the most part, I mean, not always, but more likely than not, it would be through the school district or where insurance companies and the families can get coverage. There is some struggle there. It's not always easy, but they can get some coverage. With the hearing loss that has happened within the prime of people's careers, though, when you think about when it has happened with people in the prime of their careers, what's interesting is, I mean, a person can be terminated because of that. And I have seen so many men who were superstar salesmen. And then all of a sudden, I mean, careers were rising, and then all of a sudden they lose everything. By the time that they're in their 60s, I mean, they completely lose everything, their job, their self-esteem, their families, their spouse. I mean, they lose everything. And it was all to having a hearing loss. And the impact then is realized on their families. I mean, it could be that they do have wealth to be able to figure that out. But when we also think about others who are in janitorial services who also need hearing aid technology, they can't afford a couple $1,000s for a hearing aid. Some of them are even costing as much as $4,000. So it's an economic crisis when you look at the cost of hearing aids and aided technology. It's very expensive. So we have to have this economic justice frame for looking at people's experiences with hearing loss and being deaf and deafblind, because without that, civil rights is not going to matter. Unless I can afford to receive what I need, I'm not going to be given the same opportunities to be able to be a part of a community. And we have to see ourselves as being a part of the larger fabric of the community, of the society, and how we can do things with each other. When we look at spoken language communities and environments, how they then can build consensus to providing the economic rights and opportunities for us to be able to have access and doing things with the rest of the community. That's important too.
I think hearing health and hearing loss is a tough nut to crack, and I think that we need all our organizations. Not one organization can do it, not one law can do it. And I think there are laws in place that help, and our organizations are great advocacy organizations. But sometimes it comes down to individual advocates. And we know that there are great individual advocates who will ask for their rights, they know their rights, they know what to advocate for. There's a lot of people who just don't know. And there's a lot of people that, have good days to be an advocate. There are some days when I'll send that bad meal back to the chef in the restaurant, and there are other days when I'm just too tired to do that. And, if somebody's in a healthcare situation where they might be ill and they need access, they might not have the energy to be a good.
On top of what both of you just mentioned, we have to look at the broader cost of living for deaf and hard of hearing individuals. If I want a smoke alarm, or a carbon monoxide alarm, or even just an alarm clock to get up in the morning, all of those are far more expensive than buying regular alarms for your house. And you can't go to any store, you have to find a specialty store to buy them. And that's where universal design comes in with cost standardization. It should be scaled. And of course, now with different technology, IoT for example, if we want to know when the washing machine is done, right, the Internet of Things. Thank you for that. We need to be able to know when the washing machine is done. Be it your laundry or your dishes, what have you. They beep. I can't hear it. Most deaf people go back and forth to the laundry machine to check when it's done.
Well, I think just to make light of that, Howard, I think, one of the stories within my own family is that my mother was deaf, and somehow anytime she started the microwave or any other appliance, when she would set the timer, somehow her body instinctively knew the moment that it was done. And my hearing sister said, how do you do that? How do you know exactly when it's done? And she said, well, that's just something that's a part of who I am, second nature. And maybe somewhere along the way we've lost that skill, that ability. And I don't know where she got that, but obviously it was a life skill of hers that she was so good at. She knew exactly when 8 minutes was up. And for me, I set the clock, set the timer, and then I walk away forgetting that I even started in the
walk
first
away and
place.
forget that I even put anything in there, you know?
That's very true, because I've heard now people have stopped reading paper maps, and we're using our GPS. So our hippocampus is actually shrinking. So get out those paper maps and start using them.
Right, it's kind of scary to think about, isn't it?
Right?
God help us in case of a power failure. I mean,
I know.
have to get a map, how to find things.
Really, I know. I'm lucky I'm at this Gallaudet campus today, because of the GPS. But you actually just mentioned.
Right, and deaf-blind individuals too. Right. Even the FCC doesn't provide affordable, available technology for deaf-blind individuals to make phone calls. They said, sure, here's video relay services, free video phones for everyone, free IPCTS for deaf and hard of hearing people who need captioning. But for deaf-blind individuals, they're the only ones that are very poor that get stuck behind. And they have to pay for it. Deaf-blind equipment is very expensive because it's such a small market.
I've started to have conversations with different people about how we can rethink how we raise our future generations. And I'm thinking about several different villages in the world, one in South America, one that was in Israel, even our own Martha's Vineyard at one point. And there was a researcher that told me that they noticed that within these communities, if you had at least 3% of the people within that community who were deaf, they found that within these small villages, what happened is that everyone would sign. And you only needed to have 3% of the population who were deaf for that to occur. If you think about our statistics here in America, how many deaf and hard of hearing people do we have here? I mean, that number is far greater than that 3%. And within these villages, even with our own Martha's Vineyard, the researchers were asking people within the community why they signed. And the response was, well, why wouldn't we sign? So it was a fascinating perspective that we've kind of lost that here, that, seeing if a person is different than myself, how can I work to engage them and to be, with them and work with them? The cognitive research shows that if you teach all children sign language from the age of birth through 3, that everyone benefits as a result. And I did ask, our researcher at Gallaudet University, I said, let's say that you expose people to sign language from birth through 3, and, maybe even up to the age of 5 when they start to go to school. And then they stop at that point where they're not learning it any longer in school, and they just kind of go off on their own lived experience. But then when they get to be within their 50s or so, what would happen? If you have a person who's never been exposed to sign language from the age of birth through 3 compared to a person who was exposed, they both may fail within that first test at a later age as it relates to signing fluency and gestural fluency. Their score would be the same probably, but after they're starting to take classes again, the person who was exposed is going to pick up the language much quicker than the person who was never exposed. And because of the fact that the person who had been exposed to sign language from birth, that their brain is already mapped in a certain way to be able to take that in and to be able to develop the language. So when we think about our own systems within education, I think that that's the long-term game here. It's that 50-year game for us. And I think that we need to have more of those 50-year games, or I guess you can call them strategies. We need to have more of those 50-year strategies that we start to use. If you sign with everyone from birth, that relates to mental health. It's tied to, brain health, because we know that the visual experience of using sign language enhances certain complex functions within the brain, and it also goes to prevent different diseases such as Alzheimer's. And who knew? That's how we can really change the whole view of ourselves and transform that view of seeing ourselves as deaf and hard of hearing people who hack or who are different or who have been marginalized, to then reframing that to say that we do have value. Our lived experience is of value to the rest of the world. And in those villages that I spoke of earlier, they saw that deaf individuals, were valued because of the fact that they were human. They never once thought about excluding them, even with just having 3% of their community who were deaf. So what is it that they believed about themselves that we've kind of lost here now within Western society? I think that we've kind of lost the way that we value one another in that way, and I think it's time for us to be able to find that again in our practices, in our policies, in our discussions. Yeah.
I totally agree with that. The human being, from the earliest stages till death, is so important. I mean, it has to be valued. I think that's a great point. There's so many great points that have come out of this. I mean, I could react to so many things that you all have said, and you're talking about marginalized communities and people who are deafblind who aren't getting the things they need. I think of people in rural areas who have been left out of broadband.
Oh, yeah.
And I remember when the pandemic began, there was such a surge in caption telephone service. I mean, the demand was overwhelming. And those of us who are in the know about caption telephone service and people who have them, we needed it to stay connected. But what about maybe all those who don't know about it, all those in rural areas who might not even have access to healthcare or hearing healthcare, have access to an audiologist or a hearing aid specialist?
For me, that
Yes.
is frustrating to
Frustrating
see.
to see.
Really, it's a basic need. If you think about how America was founded, everyone should have that pursuit of happiness. To be happy, to have access to education, to health care, to communication in general. So I think it goes back to what you said earlier. If you create a new technology, make it universally designed for everyone. And that concept has to start young too. It needs to begin with our children. I'll use my daughter as an example. She's 5 years old. She can hear. I'm white. My wife is Asian, Japanese specifically. We've taught our daughter 4 languages. She has just a skill when she interacts with other children, with children of other backgrounds. And I think it's because she has that access. And I can see that with her. And I can imagine if the world was, exposed to other languages, 1 or 2 other languages, one of them specifically being sign. We know that sign language is not a universal language. I get that. But the ability to gesture. If, as a deaf person, I go to Italy and someone is talking to me, oftentimes they'll gesture and make connections to understand what we're communicating. If I go to South America, same thing. We have an understanding. America, not so much. I gesture and they look at me like a deer in headlights. So, right, we need to give children that access to language, and that in turn will elevate the entire community.
I totally agree that we need to expose our youth to different cultures, different languages, but also I think we need to start exposing them to different people, their backgrounds, their needs, including disabilities. For example, as an engineer, I follow how technology changes. And sometimes people mean well, but they go about it the wrong way. For example, making the remote, a TV remote, so much more simple. And they figure, okay, why not make it easy for hearing people and blind people? No more buttons, you can just talk to your remote. Okay, but deaf people, we're sitting over here. And then it's this big rigmarole. And they say, well, we still have this supply of old remotes, and we get left with the leftovers. So this example of creating universal design hasn't been effective. You created it for one universe, but not considered everyone else. And it shows a lack of imagination and a lack of exposure of these engineers to people who have different needs or a different way of living their life. If they were exposed to that and they saw it, they would get it and include it in their design. It should be taught in all fields. Architecture, for example, needing to improve physical accessibility. Medicine, needing to understand different approaches to hearing loss or disabilities. Technology and design of technology. As well as internet accessibility. We talked about the WCAG. A lot of people who are designing programs and are technical engineers don't even know WCAG, which are the guidelines to make the internet accessible.
What about the group that we're both associated with, Teach Access? That's pretty exciting. Say a couple things about that. Oh, we're so good. Well, we're associated with Teach Access, and that's exactly what it is. It's an organization that is trying to get to students to instead of retrofitting devices, is baking accessibility into it. And they've had a variety of different ways of attacking that. And we're there as disability organizations to give our input, but I find the discussion fascinating, what's going on.
We need a lot more organizations like that. Teach America is a great program, and we need that in every elementary school, middle school, college, even postgraduate programs. That way they become sensitized to our needs and other people's disabilities. Teach Access is just the beginning. It's a great model.
You know, it's fascinating because, that just reminds me of some of the work that we've been doing here at Gallaudet. Where over the last year, we've established 2 new centers. And we had the Technology Access Program for several years, looking at access to technology. We did research on, digital technologies. We have the Motion Light Lab. We have work that's happening in the digital sphere and a lot of developments in that area. But over the last year, it has really shown me more about thinking more broadly than just technology. And it's fascinating because, when we look at the advocacy that our organizations are doing together, especially during COVID, that has brought forth research and information, to looking at the core of application for how it can be used in various areas like businesses, services, the government, and healthcare. It's going to be very helpful in that way. And, I'm now starting to understand a couple of other things. Like, for example, in the last year, we've set up the Center for Black Deaf Studies. And this is the first time that we've done this. And it was so fascinating because I saw a story that was shared just recently where we had 2 older, one is on our faculty who's the director of the center, and then Gerald Miller was talking with Dr. Karen McCaskill, where he was sharing his story about his lived experience in 1962 after Martin Luther King Jr. was assassinated. Gerald talked about this in a very powerful way from what he experienced. He said he was at work that day, and they made an announcement that it was going to be closed and that everybody had to go home. But transportation had been stopped altogether. The buses were no longer running, and so he had to walk 12 miles to his home, and he didn't understand what was going on. And both of them shared the experiences together of how they had felt left out of the civil rights movement. And it was because they didn't have access to information or captioning. There weren't interpreters at that time. So the Black deaf community, the members of the community are feeling right now their movement in a very different way. And I know that the National Association of the Deaf and Gallaudet, we really are still learning of how we as the white deaf community have not engaged, included, or even had that movement in the same way. And so we still have a lot of work to do as a result. But listening to these stories, especially when I think about 2015 and NAD, that was really the beginning of your work, working with the Black Deaf community, recognizing that NAD did not include the Black Deaf community and that they were isolated and disconnected. And so we recognize that there's still work to do going forward, and Gallaudet's doing its work as it relates to anti-racism work. This is one area in particular where I see that it's just started to make me realize that the different stories are out there that we have yet to hear that are going to continue to shape our future. And when we listen to these stories, especially the one that was shared about 1968, that has gone to influence my thinking about the future and the opportunities that we have and the power of those lived experiences that we have yet to hear. And if we can elevate those stories more so within the Latinx deaf community, the Asian deaf community, even the indigenous deaf community, when we hear more of these stories, these lived experiences, that will help to allow the word to get out there, to be able to share these stories within our communities. And they're so important because they're stories about resilience and being able to make it through and to understand that whole human condition of what can change the future and what can really impact one's lives. It's about hearing these stories. And from hearing these stories, we will come up with better solutions. And the second thing is that over the last year, we saw the greatest threat to our democracy. And now it's just fascinating to think about what that then means for us. Again, it's quite fascinating. For one thing, it's about being able to build the understanding of the importance of having dialogue and discussion and really wrestling with differences. I remember going to Congress at one point, and somebody had brought up the fact that they heard that there was all of this commotion happening at Gallaudet. And I told the congressman, I said, what, Gallaudet is like Congress for the deaf community, where we're always making sausage all the time, and it can be messy. And when I said that, he really got what I was talking about. And I think that that's really the heartbeat of our community too, is when, our various organizations struggle with something. I've seen conversations where we're talking about children and what we need to do to learn. The power of democracy is something that has allowed us to be the nation of joiners, working together with one another. And when I think about our work, especially looking to strengthen our democracy, because without our organizations, without that representation, our systems start to become more weaker as a result. So for the people who are watching the panel today, I think it's important to remember that their engagement with our various organizations, with being a part of the community and doing the fight, it's hard, it's messy, relationships can be hard, but the value is there. And that's really what keeps democracy alive. It's really what keeps that hacking culture, problem-solving culture so prevalent within our community. And it's, given me the energy and the belief in the future for what's possible. We often talk about technology, and we don't often talk about democracy, or we talk about, technology without talking about economic justice or racism, autism, or all the other isms. So what would it look like for us to have a more holistic conversation together about how everything is interconnected? I'm looking forward to that, especially after COVID. I think that that's really going to be our work going forward.
Part of the shift in politics these days has left our country more divided than ever. Many people have been left out, especially Black, Indigenous people of color and people with disabilities, and then even more so BIPOC people with disabilities. And that divide almost seems like you're either for or against. And that just doesn't make sense. We should all be for equal access for everyone, no matter your race, disability, gender. And unfortunately, our country has become polarized. And I don't know how we go about having a conversation to resolve that. I'm not sure. I'm a lawyer with all of my training in law school. We know that civil rights and that process occurred to be more equal, but now I don't see that anymore. And I don't know if that's the path that we're even on anymore. We've come to a fork in that road.
I noticed that the women here seem to be lifting your spirits up today, Howard. Kind of noticed that.
Sorry to be the Debbie Downer.
Right. We're bookends. You're right. I'll also mention that we just established this past year the Center for Democracy in Deaf America. And in fact, I'm now teaching a class with two other individuals, Dr. Stern and Lorenzo Lewis. And the class is entitled Dialogue, Deliberation, and Democracy in Deaf America. And there's a person who wrote a book, a very short book that I recommend that you read. It's called With, and it was written by the president of the Kettering Foundation. He's really been a student of democracy and democratic action. And it's a very short read. It's online. It's free. And, in this, he makes the very thoughtful argument about by, for, and of the people. That really what democracy means is the ability to work with one another, to work with the people. And what we're asking today, I think, is that same type of language, especially when we're going to legislators and schools, when we're looking to be able to innovate. We really are looking for people to work with us. And that has inspired some of my thinking about the importance of how we go about framing our future. I mean, you and I, Howard, are trained attorneys, and we need to have systems of, law and the rule of law to be able to govern in a democracy. But I have to tell you that our system of laws really do not work well enough for people with disabilities. They just don't. And for BIPOC people as well. I do think that some of the heart really goes back to the Supreme Court and the policy setting that happens at that level. And even with Congress, that we have a lot more work to do to be able to create a system where people will feel that the rule of law has value to them as an individual. My worry right now is that people will feel that the rule of law does not show its value and that it doesn't have any applicability to them, and therefore they won't obey it. I think that's troublesome, where we have to be able to create and build something that goes to show the value of our democracy to people and the experience
Yeah,
of
I
it.
agree.
It's messy.
Oftentimes
It's
I
very
share
messy.
with members of our community that the best or the ideal way to influence change is to share stories. Stories lead to data. You collect the data for organizations like us. The more data we have, the more we can justify what we're recommending, and then usually we can come to a resolution. So we need to engage with members of our community, listen to them. And I know that not all stories are easy to hear, especially with native land or territories that are often ravaged by hurricanes. They're still part of our country. And we can't just keep focusing on us and assume we're doing fine and not include them. We need to bring them in.
And if I could bring Dr. Stern to this conversation, one thing that he talks about in his class and teaches about is the importance of democracy not just being at the individual level, but you also need to have the organizational level alive within a democracy in order for a democracy to be effective. So you need to have the individual, the organizational, but also governmental level, and that's what creates the ecosystem for change. It's what de Tocqueville had written about when he talked about us as a nation of joiners here in America. And that's what I'm seeing here, is the delivery of services to the mission that our organizations have and delivering that to the community, but we're only as good as the community that then joins in with us. And we need their stories, we need that data and that information, and that's the commitment that's needed for change. It's so desperately needed.
Just a final comment going back to the purpose of our panel today, technology. Technology is one way for us to connect, to share our stories, gather that data, find ways to have a dialogue to change the world for the better. But it's only as good as the technology we're able to use, and that needs to be accessible, and that can be a powerful way that we can influence it as the deaf and hard of hearing community.
Have we moved the needle? Can I ask that question? Over the years, what do you think? Have we moved the needle?
Through lawsuits, yes.
Barbara, I'll say to that, to the question of have we moved the needle, it's fascinating to think about, because if you were to ask the generation before us what their experiences were compared to what we're experiencing now, they would say, of course you have. But if we were to ask the younger generation, they would say, no, you haven't to this point. And I think that's the role of young people. Quite honestly, I think that we need to listen to them. You know, we need to be motivated to see what they can bring us to this conversation.
I think that's part of not having anything before and now having something that's new. If you're born with everything, you don't need more.
You know, I've had several interns, mostly from Gallaudet, some recent graduates, some still students, and I told them that I was impressed with them compared to the older generation because they have better access to communication now. They're better able to mobilize and shake things up. It took us years to get to that point. And I look at the younger generation and they're really in a position of power to really change things and help change things for the better.
Yeah,
for
and I'll
everybody.
share something here with you, Eric, because, I mean, first, I love that story that you've shared, and I do want you to remember something, too, that the older generation, from what I saw happen, that was pretty similar here, is that whole value for one another. That because a person is deaf or hard of hearing or deafblind, that there's care, there's value within that individual just because, you know, there was that connection to each other. So we have to find those connections, and the tools that they used back then were, I think, at a slower pace where they had to write everything down in a book and then things needed to be sent through snail mail. So it was all done manually back then. Right? Can you imagine that the TDI address book was really our Bible, you know? And now it's so fascinating because with cell phone technology and all the different changes that have come about, you know, how we keep in touch. I mean, there are different challenges that come with that nowadays, but I think what's consistent and what we see that's similar is that value for one another, that value of care, and I hope that that's something that we can continue for each other. Showing value for one another, that there's that shared lived experience and that's sufficient to be able to connect us to each other, to be able to support one another, because without each other, we will lose more as a result. And I'm also thrilled to hear about the stories that you shared regarding our Gallaudet alum serving as interns working with you. That's great.
So, joining and leading TDI has been my most rewarding experience. I've seen our organizations work together. We serve such a diverse group of people and we stick together regardless of hearing loss. The goal is to make sure that all of us have access. And it's been really inspiring for me, and I look forward of us working together more and pulling in other organizations to grow our coalition more. Unfortunately, we've run out of time. We could probably have a second or third fireside chat. This was truly enjoyable. Thank you.
Thank you, Eric. And
It's
thank
just
you,
been an
Barbara. Thank you,
absolute
Bobby.
delight. It's been so wonderful, so thank you.
Nice discussion. I really
And
like
thank
that.
you, Eric, for thinking of this idea and really inviting us
Yep.
to the table.
Thank
It's
you.
been wonderful. And congratulations to you.
Thank
We're
you.
looking forward to supporting your continued
Likewise.
future
Thank you.
success. Again, congratulations.